Instrument cleaning and packing is very, very important. So the first thing, it starts right in the theater immediately after the surgery. You segregate it and flush all the luminous instruments, clean them, wipe them just immediately after the theater and dispose of whatever is needed. So the cleaning and packing starts right in the theater immediately after the theater. And the best method of doing it is the 3-bucket technique. Once you got it, you have distilled water or RO water in 3 trays, and in the first tray you can add a mild disinfectant. Now it's commercially available as InstruClean from Oral Lab. Just add that in it, soak the instrument in the first tray with the disinfectant and clean it within the solution, and don't do it outside the, I'll show you now. Now just soak them instrument for a few minutes there and be very gentle. This is what I was talking about, InstruClean, which is available with the Oral Lab. It is nothing but cetrimide, which is commercially available as Savalon. You can use that, dilute it and use it. So after you soak it, use soft toothbrush. And this is the wrong way of doing it. No, don't do it outside the solution, because it's going to produce aerosolization, which is dangerous. So this looks neat, but this is not the proper way of doing it. This is not the proper way of doing it. So when you do like that, see that aerosolization, you're going to contaminate the entire area. So the ideal way of doing it is clean it within the solution. That's the proper way of cleaning. And once you have done it in the first tray, repeat the same thing in the second and the third tray before you send it for drying. And autoclave ultrasonic cleaning is a good procedure, but please avoid the enzymatic cleaner, because it's reported that the incidence of TARS is more with enzymatic cleaning. This is not advisable now. So ultrasonic cleaner with heater is also available, which is this is the smaller version of it, where you can use small cannulas and things. And this is the indicator for it. It turns blue, turns red once you dip it in the ultrasonic cleaner, indicating that the adequate amount of ultrasonic energy is dispersed in the cleaner. And coming to the cleaning of the phaco handpiece, usually what we do is like this. Just aspirate like this and put it. Is it correct? No, this is not the proper way of cleaning your handpiece. The best way is unidirectional. If you are sucking, only suck. Don't push again. This is it should be the flow should be in the direction of the flow as you do surgery. In phaco handpiece, the nucleus piece is sucked in the direction. The other one is infusion is through. So this is the proper way of cleaning the irrigation port. So be very careful while doing your, about 200 ml of your solution should be injected, that is distilled water should be injected to clean the handpiece. Better to avoid RO water for cleaning your. Same thing applies to your irrigation aspiration cannula also. This is for aspiration, you aspirate the cannula instead of pushing. Normally we do this. This is wrong actually. You have to aspirate only. We think that when we push it out, we are going to push out all the dirt within it, or the nucleus matter, or the cortical matter which is inside. But this is the way to do it. This is the proper way of doing. The same thing applies to Simcoe cannula also. It should be unidirectional, the same way as the fluid flows through it. And improper technique, see, is cleaning his instrument outside a toilet. That's not a safe place for you to clean your own. And what is wrong here? They are packing it without drying. Always the instruments should be dried before sending for autoclave. And wipe clean with lint-free cloth. Don't use these ordinary gauze or anything which will leave fibers, cotton fibers on it. Now it is commercially available as lint-free cloth. It's available in the Amazon. It's used for cleaning. And pressure pumps are very good. Air pumps are very good to dry luminous instruments like this. It's commercially available for it's called the blowers, or just dry it like this before you send it for autoclave. You can even use hair dryer and check all the instrument under the microscope before you send. Check for patency once it is dry, and look for the sharpness or edge. Use of silicone sleeves like this is very good. It will protect your instrument. And pack it in serrated boxes like this, and include indicators in each set. Pouch is the best way of packing it. And these are the instruments. Now, these are the different packing methods for your instruments. This is called the envelope, parcel method, wherein you fold and repeat the fold backwards. Every time you fold, keep a fold outside. That's the way of doing it. This is the parcel way of packing. It is meant for the theatre staff to start the theatre initially. Just remove it, put it on the table, on the tray, and then open and start the theatre. That's the way of doing it. Yet another method is the envelope method. It looks like an envelope. Here again, leave a flap for all the fold you make. That's the way to pack fold. This method is used for introducing a set to the surgical site. You hold it and hand over a set to the surgical staff using this method. So you open up like that, hold the flap without touching the inner instruments what you are going to hand over, and then you hand over to this. This is called the envelope method. Now most of us are changed to disposable gowns, but if we are still using the older method, especially the government hospitals, we use this reusable cloth gown for surgical gowns. But look at the way he is folding. It looks very nice, everything. This is in a gynec hospital which I recorded, and the anesthetist has come. He's opening up and seeing, he doesn't know which is the head or the tail of the gown. and trying to open it, the front, back, everything is confusing. Ultimately, he's contaminated the entire thing with his wet hand. So, he is wearing. There is a proper way of folding the gown, surgical gown. Say, look at this. This is the way it has to be folded. So you spread it around, fold it into half, fold the back portion into half again. Hope you understand what is being done. The arm is part is kept in front and it is folded into half, and it looks like this. The back flap is folded halfway. The entire thing is folded again into 3, and the center portion is lifted up in a W-like fashion and folded into 4 layers. Ultimately, what happens is the shoulder part comes on either side. This you can tie it up and send it for autoclave or ETO sterilization, whatever you are doing. The same method can be used for reusable, disposable also, if you are using it for the second time also, if it is not too contaminated. So the advantage is, when you remove from the bin, just all what you have to do is just introduce your hand like that and just open it up. It opens up. So this is one of the best way of folding a gown. Thank you. We'll go to the last topic. After that, we'll have a few minutes for discussion. No. I'm continuing. 1, 10. I'll continue with this. Same thing, validation.